literacy might be a way to help us build resilience so that people themselves are empowered to recognize what is good information and what is bad information. There's a lot of research on a bunch of different ways of defining literacy, all of which has some promise, but all of which also has a bunch of limitations where they haven't necessarily applied them to this topic. So that's a space where getting all of these people from different fields in the same space really helped build that groundwork that will allow us to test literacy against infodemics. Likewise, thinking about the personas that one of the participants mentioned, thinking about who the vulnerable audiences are, and whether we're talking about vulnerability in terms of disease versus in terms of information consumption versus in terms of information spread is going to be really important. The other kind of ways to think about it are in terms of what are the actual interventions that we need. And so we decided that as a team, what we need is a living systematic review, a place where all of us can look and see what is the misinformation that is spreading, what are the characteristics that are going to make misinformation spread particularly problematic, and then what are the interventions that we know are likely to be successful against those types of misinformation. Again, there's so much great research being done, even more than I was aware of. And so finding a place where all of us can speak to each other more quickly, more readily, where we're building on each other's work rather than working in silos is, I think, the promise that this conference really represents to all of us. And so I think it was a fantastic experience and one that I hope can continue with the foundation that we've laid in the past 2 weeks to inform all of our decisions and reinforce the connections that we made over the past few weeks.
Thank you very much, Emily. Very happy to hear your experiences and also the desire to continue this work and collaboration that's ongoing around the world. I'm going to now pass to Pier Luigi Sacco. Pier is a professor of cultural economics at the IULM University of Milan. He is also a senior advisor and faculty associate at the Berkman Klein Center for Internet and Society at Harvard University. Pierre was a participant at the conference and is going to comment on his experience. Pierre, welcome to the webinar.
Thank you very much. It's been a wonderful experience to participate in this webinar. And I would say that most of us, as Emily, by the way, was remarking just before, most of us have experiences of disciplinary conferences where, of course, you have very exciting meetings with very competent colleagues. But at the same time, in some sense, you're all on the same boat and you know exactly where this boat is going, more or less. But here, you have a completely different kind of experience. This was about connecting a very diverse community from the point of view of the disciplinary backgrounds of people who were very different, the competencies that despite the difference in background, there was yet a further level of difference in the specific competence and interests, and of course the geographical variety of the group. So this was really refreshing. And gave, I think, to all participants an incredible opportunity to understand in this moment what is the pulse of the different sensitivities, the different views on such a complex problem like infodemics. What if I should summarize briefly in one sentence, what was the purpose in the end of this exercise was probably establishing a forum for collective intelligence. It's really something about not simply just bringing together many reasoning people, but creating a new layer of reasoning that was really, in some sense, getting out the best of the single disciplinary perspectives. And this, of course, was difficult, and clearly we are just at the beginning of the journey. So first of all, it was about finding and co-building a transdisciplinary space to frame infodemics, because clearly, I mean, there are so many angles from which you can take it. So how do we establish a common space for this? So this was clearly the first step. And I think that throughout, I mean, I, of course, had a different experience from Emily because I stayed in the same group for all the 4 stages. But what I saw, for example, was that this was this gradual building of this common space. And more confidently, we were able to interact with each other, knowing each other in ways that would really enable a different level of reflection. A second aspect is, of course, translating and in some sense going beyond disciplinary languages and mentalities, because of course in a situation like this everybody comes with a vocabulary, everybody comes with a frame of mind that is shaped by their own discipline, and it was very important and meaningful and difficult to establish more and more a common language. And in this sense, of course, what the glossary did was amazing. And I think, again, this is just the beginning. We can really do a lot starting from this glossary. And then, of course, the problem has been, and still is, the difficulty in achieving a synthesis. Could I say that now I have a clear idea how to tackle infodemics after this webinar? Of course not. I understood how difficult it is to achieve a synthesis. But at the same time, I also saw very concrete possible steps to arrive there, and especially how useful plugging into different disciplinary frameworks can be from this point of view. So I think that the common feeling that emerged from this interaction is, and it was just repeated also, by the way, at the end of the session, the final session by all participants, was the clear understanding of the value added of working together in this way. So I think that what the WHO did with this is already a milestone in its own right. The fact of creating an environment for such a level of global collaboration on an issue is an endeavor in itself. But more concretely, what did we get in terms of takeaways? Infodemic, I think that one thing that is clear, and I think it's also important to stress this further, is that there are several different viewpoints that are crucial to understand infodemic. There is a computational viewpoint. Of course, big data from this point of view are of crucial importance, and our ability to tap into this incredible flow of information is probably going to make the difference, because this means in particular being able to react in real time. It's almost impossible to have an evidence-based intervention through sources other than, for example, social media and online content that really tackled by tools like social network analysis, but also has more elusive dimensions. And there's clearly a communication dimension, which is extremely important. And again, by the way, this means that we arrive with a certain understanding of what communication is. That is an understanding that is an evolution of the social and communicative world we are accustomed with. But the point is that in the new situation, probably the challenge is also from the point of view of communication. For example, how to communicate effectively in the face of, let's say, epistemic community that believe that fake news are real. How do you really deal with this? This is something for which nobody really has today an established expertise. We really need to build together a completely new approach. So the point is that all these perspectives are important, and yet no single one of them is enough to tackle properly this particular challenge. So what is needed is, from this point of view, as an unprecedented level of disciplinary synthesis, which is interdisciplinarity to an extent, but probably it's more. It's creating a new discipline from scratch, from different contributions coming from different fields. And this is much more challenging, but also at the same time, I think, much more exciting also for the future developments of social science. At the same time, this also calls for unprecedented alliances, not only in terms of scholars and policymakers, academics. Of course, it has to go to cut through the whole society, the whole economy, and again, establishing this level of partnerships is particularly complicated and challenging, but indispensable. I think that some of the ways out that, by the way, also emerge from the discussion are, first of all, we need to design behavioral change interventions that really work. Probably the only way to flatten the curve in a moment like this for a long time being will really be designing behavioral interventions that work. And so this really means tapping into a growing body of knowledge that, again, I think is today brilliantly deployed in many disciplines, but in this particular one probably will also need some specific experimentation. Second, capitalizing on natural experiments. The point is that in moments like this, that are moments of exceptional change, you also have context for natural experiments that are absolutely impossible even to conceive of in normal times. So we really have to be able to catch the opportunity to seize the opportunity whenever it happens, whenever it emerges. And so this really also means promptness of response with respect, for example, of the natural change situations that lend themselves to be studied to this purpose. And then cross-cultural research. What is emerging very clearly and was so clear from the discussion is the fact that infodemics is not a phenomenon that has a global, let's say, uniformity. From the point of view of the various socio-cognitive aspects. Infodemics in different socio-cultural contexts have completely different implications, just to make an example. Also, if I take a completely apparently inoffensive kind of communication like satire or humor, what is satire and humor for one culture is not for another. So, for example, you can create fake news, even unwillingly, simply because people misinterpret from a different cultural angle what you're saying. So this really means that cross-cultural research becomes a pillar of the future approach. And then understanding what works from the point of view of building what we could call an infodemic pro-sociality, which means what kind of moral emotions can we harness to...
All right, that's the WHO briefing on the outcomes of the Global Infodemiology Conference. Of course, infodemiology being the science of distribution and information in an electronic medium, specifically the internet, or in a population with the ultimate aim, of course, of informing the public health and public policy. So that's what the WHO is up to then this afternoon. Well, the Chinese company that's behind one of two leading COVID-19 vaccines candidates is racing for the launch of phase 3 trial of its drug. And of course, that's why I suppose the WHO is having these sort of conversations then around this time when it comes to vaccines. Let's take a short break. More on this after this.